So one of the most common questions I get asked is whether breast cancer can affect our menstrual cycle, and if so, how? And interestingly, it's actually the other way round. The number of periods we have affects our risk of breast cancer. That's why as a gynaecologist, I'm so interested in knowing when you had your first period and how old you were when you had your last period, or go through the menopause, as it were. Other things I'm interested in is the regularity of your cycle and the age of first pregnancy. Now, it's useful to know that in terms of breast cancer in the early stages, it doesn't necessarily affect your periods, but chemotherapy and the later stages of breast cancer can affect the timing, the duration, and the nature of your periods. So how does chemotherapy affect women's menstrual cycles? Well, it really depends on the regime and the dose of medication you're taking, as well as the type of breast cancer. And remember, chemotherapy is a really strong cocktail of medications. In terms of how it affects your menstrual cycle, well, it can change the regularity. In some women, periods can actually stop, and it can also affect the duration, the length of your periods, and the flow, so the heaviness of your periods as well. So there are a lot of side effects associated with chemotherapy. They can be both emotional and physical. Just looking at the physical changes first, they can range from a change in your appetite, nausea, vomiting. You might experience some diarrhea or even some mouth ulceration. You may also notice some hair loss, easy bleeding or bruising, and a higher risk of developing infections. In terms of the emotional changes, you might find that you're more irritable, you're experiencing mood changes, or in fact tiredness. But again, that's why it's really important to consult your oncologist, and even under the circumstances, your gynaecologist, sooner rather than later. So in terms of how quickly periods can return after having chemotherapy, this is really variable. It depends on the regime, the number of doses and cycles of chemotherapy you've had, for example. But generally speaking, in women under the age of 40, they tend to return within a year or so. Having said that, it's not set in stone, and it is very variable. In terms of how many women experience a change in their cycle during chemotherapy, generally speaking, it can be anything between 20% up to 70% of women experience a change or a stop in the flow of their periods. Now, breaking that down further, it's generally around 5% of women aged under 30 who have a significant change, so a stop in their menstrual flow completely. Looking at the 36 to 40 age group, there it's about up to 50% experiencing a change or a stop in their menstrual cycle. Now, some mixtures of chemotherapy do have a higher risk of affecting or stopping your periods, so it's really important that you discuss this in advance with your oncologist. Also bear in mind that even if your periods do return, that they may not return in the same regularity or manner as you had prior to chemotherapy. So if need be, discuss this with your gynaecologist in advance or during chemotherapy. So what happens if you lose your periods during chemotherapy? Well, the first thing to do is to speak to your oncologist as well as your gynaecologist early on. One of the options that may be useful here is to consider egg freezing, but think about that sooner rather than later. Now remember, not all women will actually stop having periods. You may just experience a period of irregularity or a change in flow. If your periods do stop, you might actually find that you're experiencing symptoms of the menopause, for example, night sweats or hot flushes. Again, make sure you seek help earlier, because we can actually do something about those symptoms. So consult your gynaecologist and your oncologist in due time. People react to chemotherapy in different ways, and equally the time taken to recover will vary from person to person. On the whole, it's actually no different from having a healthy, balanced lifestyle, so looking at a balanced diet. Where possible, try and avoid alcohol and smoking. Now, if you're not sure whether you're following a healthy, balanced diet, it's a good time to consult a dietitian to see whether you need to add in any supplements into your diet. What about pregnancy and chemotherapy? Well, bear in mind, if you're having periods, even if they're irregular, you still could get pregnant. So, in terms of contraception, you could consider barrier contraception, such as condoms or the diaphragm. Another alternative might also be the copper coil. So if you're not sure what's best for you, speak to your gynaecologist early on. The national guidance suggests waiting up to 2 years before trying for a pregnancy after chemotherapy treatment has been completed. But rest assured, even if you do get pregnant during that time, most pregnancies are successful. Well, it's natural to go through a whole range and mix of emotions, and this is where measures such as meditation become really important. Also look at your family network of support, so your family and friends are really key to supporting you through this time. Cancer support groups and counselling may also be really helpful in terms of talking through your concerns and worries during this time.